Hello to all you future family nurse practitioners. My name is Morgan Bussey, and I'm also an FNP. I currently work full-time in a busy primary care clinic, and I absolutely love my job and I love teaching. I'm so happy to be here with you today to help you on your journey. Before we get started, I just want you all to remember that while you're preparing for your board exam, just know that this information is stuff that you already know. It is in your brain, and you're gonna do great. Just take some deep breaths before your exam and just know that it's all there and it's going to go wonderful. Okay, let's dive into reviewing what the most common thyroids and their significance. Okay, so here's a diagram that I have just for a quick refresher on the anatomy and physiology of the hypothalamus pituitary thyroid axis. Since we're talking about the thyroid, let's just start here and work our way around the entire negative feedback loop that makes up this axis. Remember, the thyroid is a gland that sits in the middle of our upper trachea between the second and third tracheal rings. It produces hormones, T3 and T4, also calcitonin, but for today's purposes, let's focus on the T3 and T4. These hormones are responsible for regulating our basal metabolic rate, our energy expenditure, and they affect things like our temperature and our heart rate. They also signal to our hypothalamus, which lies in the ventral part of our brain, above the pituitary gland and below the third ventricle. Among lots of tasks that the hypothalamus has, in this case, it's responsible for producing TRH. TRH then stimulates our pituitary gland. The pituitary gland sits at the base of the brain, right behind the bridge of the nose. In response to TRH, the pituitary releases the hormone TSH, which is called the thyroid stimulating hormone. That makes sense. Think about the name, thyroid stimulating hormone. Its job, it says it right there, is to stimulate the thyroid. So the pituitary gland releases TSH. TSH works to the thyroid does its job, which is to produce the T3 and T4, the active hormones that are going to be doing our regulation. Okay, I just made another table here for you guys. Anybody who's a reading kind of learner, visual learner, you can go ahead, pause the webinar at this moment and go ahead and read through this slide and take notes if it helps. One more view to really nail in this concept. So remember, just what does a negative feedback loop mean? A negative feedback loop really serves to reduce any excessive response, and it really keeps any variable within a normal range. So when we're thinking about the negative feedback loop that involves the thyroid, and when we're looking at our patient's labs, our starting point is really to focus on what's most important, the TSH and the T3 and the T4 levels. We don't check the TRH. It's not something that we do commonly, so we'll move on from that. In the boards, TSH, T3, and T4 are going to be the most important labs to remember. Okay, so let's follow this loop one more time. The hypothalamus stimulates the pituitary. In response, the pituitary releases thyroid stimulating hormone that goes down to our thyroid. Our thyroid then releases the active hormones T3 and T4, which then come back to the hypothalamus and regulate how much more work that hypothalamus needs to do. If the levels are high, then the TRH and the TSH will start to come down. And then on the other side, if the T4 and T3 levels are low, then the hypothalamus begins to think, okay, we need to increase production. So it signals to the pituitary, which then signals to the thyroid. And that is how the hypothalamic pituitary thyroid axis functions. However, there are common conditions, oftentimes autoimmune conditions that can cause our thyroid to malfunction. So we'll go ahead and review those common disorders on our next slide. Okay, so here are our most common disorders, most likely to be covered on the board exams. I wouldn't focus too much on memorizing the actual lab values here, but I do want you to grasp the concept of how these lab values will shift given our most two common thyroid diseases, hypo and hyperthyroid disease. So here you can see the euthyroid or the normal thyroid state and look at those labs, specifically TSH again and T3 and T4 values. When we have what we consider a hypo or low functioning thyroid, we have a thyroid that's not producing sufficient levels of T3 and T4. So we can think back to our negative feedback loop and understand what low levels of the T3 and T4 due to the hypothalamus pituitary function. When we have low levels of these hormones, the hypothalamus responds by producing more TRH, stimulating the pituitary, and then the pituitary responds by saying, hey, thyroid, you need to produce more active hormones. So the pituitary secretes more of that thyroid stimulating hormone, TSH, to get the thyroid to work. It is now screaming, hey, thyroid, we need more. However, if we have hypothyroid disease, our thyroid just can't keep up with the production. Whatever's happening, for whatever reason, even though we keep getting this message, this high, loud screaming from the pituitary to work, for some reason that T3 and T4 don't. So what do our patients feel? They may feel kind of slowed down. They may even feel a little bit like they're gaining some weight, or oftentimes really cold. Their heart rate might kind of just, the resting heart rate might come down a little bit. So what do? We replace them with T4 levothyroxine medication, and they bounce right back up, and we bring that T3, T4 levels up, and what happens? Then our TSH, which was here, is now going to come down, and we get back to this euthyroid state where everything is functioning as it should. All right. Now, in a hyperthyroid, our thyroid is doing the opposite of the hypothyroid. Here, we see a thyroid that is joyfully overproducing the active hormones, T4. Our patients feel amped up a bit. They might have kind of a high resting heart rate. Maybe they're even a little bit sweaty. They could lose a little bit of weight, sometimes a lot of weight, depending, but overall their metabolic rate is high. Okay, so what happens when the T3 and T4 levels are high? That hypothalamus shuts down production. Yep. It says, hey, listen, pituitary, we are good. We do not need any more active hormone. I am getting flooded here. And so that pituitary says, I'm not being stimulated. So what happens to our thyroid stimulating hormone, which is released by the pituitary? It comes down. So here we have our T3 and T4 up here, and our TSH is coming down low, low, low. All right, what do? Give them a little methimazole, do some other diagnostic tests, figure out why this is happening, and we try to get those T4 levels to come down, which then cause our TSH levels to come back. We reach our euthyroid state, and everybody is happy. Okay. So you have got this. Let's test your knowledge here. So you receive the following labs. What is your most likely diagnosis? Here, our TSH levels are high and our T4 levels are low. Hypothyroid, you got it. So what medication will you be prescribing for somebody with a hypothyroid state? Yep, levothyroxine. Awesome job. All right. And one more, just little threw in the negative feedback loop one more time for your enjoyment. One more question. Your patient comes in, they were diagnosed with hyperthyroid several years ago, and they ran out of their medication about 4 months ago. When you draw their labs, you expect to see that their TSH is what? High or low, and their T4 to be high or low? Give it a minute, go ahead and pause. Yes, when we have a hyperthyroid state, that pituitary brings down the stimulation, but our thyroid is for some reason producing and sending that T4 out there. What medication do we use that I went over? Methimazole. You've got this. All right, guys, you're going to do great. Remember, these board exams, they just exist to make sure that you are providing safe care. You have the knowledge, you know all these things. Take some good deep breaths before you're going to answer anything that's stopping you up. And remember, select the safest answer always. All right, it was such a pleasure. I hope you got this information in, and I will talk to you soon. Take care.